So growth hormone is probably the king of all our hormones, the top of the hormonal chain if you want to look at it that way. I believe that if growth hormone was discovered today, it would be called human regenesis factor. When it was discovered, all we thought that it did was help children grow taller, but today we understand that it is one of the, if not the most important hormone in our body. It is responsible for unbelievable amounts of repair, regeneration. What it does for Alzheimer's, you will hear about in the future. What it does for cardiac protection, you will hear. As a surgeon, we know what it does to help the body repair after surgery has been around for decades. Well, everybody's heard the negative about the athletes and the illicit use of growth hormone. We don't use that kind of a product. We use a product, different types of peptides that are the same as or autologous or analogous to growth hormone releasing hormone, which is a hormone our bodies make. But as we got older, we started to make less and less. And as a result, we made less growth hormone. When we were younger and more vibrant, more healthy, we had higher levels of growth hormone. Well, we can help restore that with our protocols using these natural growth hormone releasing hormone peptides. So this is a subject that we'd like for our potential patients to speak to us personally. You absolutely need to find a provider who understands the nuances and the details that go along with doing this very safe type of protocol and enhancement. Its repairs and its regeneration results are fantastic. I mean, we like to look at it as icing on the cake. You can tell which of our patients are using this protocol when they walk into the office. The changes are that remarkable. Growth hormone today can only be delivered via an injection. Now, the good news is the injection is so tiny that a 6-year-old can do it. Literally, it's the same syringe and needle that children use that have diabetes. It's absolutely painless. And when men and women see the results, which typically take 3 to 6 months to see, and it will completely be seen by around a year, it's worth every bit that they do. The men and women who are over the age of 25 are on the decline as far as their growth hormone production. And more growth hormone is going to bring back that more youthful appearance, and it's going to help repair parts of the body. I had a patient who was looking at his before and after pictures, and they were astounded. And he said to me, he said, "Doc," he goes, "if this stuff is doing half as much on the inside of me as it's doing on the outside of me," and I interrupted him, unfortunately, and said, "It's doing as much on the inside of you as you're seeing on the outside of you." And that's what's so wonderful about this hormone. It's repairing and rejuvenating. You can see it on the outside, but it's doing the same thing on the inside. Look it up, what it does for neuroprotections, Alzheimer's, cardiac protection, injuries. We have quite a few healthcare providers that prior to any surgeries are come to see us specifically to get on this program because they understand how much it helps with preparing for surgery and then healing afterward. Now, what are you going to see? First and foremost, you need to be doing something on your own. If you're coming in here, and this is not our typical patient, but if somebody came in and they don't exercise and they don't watch what they eat, and they think just doing the growth hormone protocol is going to transform them into some movie star, that's probably not going to happen. But if you're doing your work, if you're watching what you eat and you're doing your exercise, particularly if you're also on the other hormone balancing programs that we have, then you're going to start building muscle mass and you're going to start losing fat. And then you add the growth hormone protocol, and that's where you're seeing these men and women come back with a much more cut, more defined physical appearance, particularly in their core areas. Men and women who lose the fat start to get nice and trim with the addition of the growth hormone protocol are now starting to see the 6-pack or the 4-pack. Hair color. Most men and women will report a darkening of the hair or more younger looking youthful hair. Gray doesn't go away completely, but it decreases quite a lot in men and women. Skin texture. Your face begins to look, the skin looks much younger. I oftentimes bring up movie stars because we all see them on TV, and we have high def nowadays and we can really see their features. That's not all plastic surgery. that quality of their skin, almost all of them that you're seeing are doing a growth hormone protocol, and you're seeing that youthful skin appearance. You see that in our patients, that glow that younger people tend to have. So it's one of these things. We have the pictures in the office of our patients that have given consent to allow us to show their pictures, and we'll show somebody who's interested examples of men and women who have been with us for a couple of years, and we'll show you pictures every 3 months. And the progression that you will see is pretty astounding.